Hey guys, what's up? Victoria here, Sports Nutritionist with Paddle Monster, and today I want to talk to you guys a little bit about hydration. I've had an incredible amount of people this year with this super hot summer that we've all been having, with lots of questions about hydration and dehydration and how to go about hydrating properly for races. So I wanted to just touch base a little bit about that. I know we're in the end of the summer, except for us people in Florida. We are summer all year round, but it's important to know, even when it's not hot, it's still important to know this information for hydration, so that way you can complete your race feeling good, not injure yourself by getting dehydrated, and go from there. A lot of the guidelines that we're going to talk about today are very general, but it can help, and it's a lot better than not doing anything or not knowing anything about hydration. Hydration has a lot to do with sweat rate and sodium loss. People sweat differently, so their sodium loss is different, their electrolyte loss is different. Once you lose about 2% of your body mass, that's when you start to experience impairment. So for an example, if you weigh 140 pounds and you lose 2.5 pounds of fluid after you work out, like you weigh yourself before you work out, you weigh yourself after, if it's 2.5 pounds different, that's when you're going to notice an impairment. Now you think 2.5 pounds is a lot. It actually isn't, especially if you live in a super humid, super hot place, if you're working out in the middle of the day and you're sweating a lot, and you're going hardcore at it. 2.5 pounds really is not a lot. I mean, I know a lot of times you get on the scale beforehand and you work out and get on the scale after and you're like, yeah, I lost 2 pounds, it's so cool, yay, take a picture of it, put it up, look, I'm 2 pounds lighter. Okay, that counts, but it doesn't, but it's definitely important to be aware of. A couple of things to be aware of with dehydration, some signs and symptoms. Thirst. Obviously, you don't want to get thirsty. If you feel thirsty, you're already starting to be dehydrated. Dry mouth, dizziness, cramps, headaches, rapid heart rate, fainting. We definitely don't want to get that far along. But once you start noticing the first signs and symptoms of thirst and dry mouth, cramping, it's kind of too late, but you definitely want to get to know those signs and symptoms. If you have a headache when you're working out, it might not be because you have a headache, it might be because you're dehydrated. So what are some things that you can do to limit this? Well, one thing is to be aware of the color of your urine. I know it sounds gross, not too many people want to look at their pee necessarily, but it's definitely important. If you notice your urine is darker just in general, you are dehydrated just in general. A lot of us are dehydrated in general. If you are going to work out, maybe check your urine before your planned session and then check your urine after. I know it sounds gross, but also know your training environment, the temperatures. Where you're training and where you're racing might be two different things, so it's not a bad thing to plan out where you're going to be racing and try to train in those same kind of environments. I know a lot of times, I live in Florida, a lot of times people will come down here to race from colder places and they don't do so well because they have to deal with the temperatures, the hot, humid temperatures. Know your body. Do you sweat a lot? Some people are naturally sweaty people. Some people just sweat. Some people don't sweat a lot. So know your body, know what's normal for you. Another thing is knowing your equipment, your pack, what you're using, your water pack. So I know it kind of gets a little harder and it gets a little more individualized, but just in general, every 2.5 pounds that you lose is about 1 liter of fluid. So if you work out and you lost 2.5 pounds, you actually lost 1 liter of fluid that should have been replaced during your workout to keep you to maintain the same weight, which means you're properly hydrated, obviously. This being said, I think it's safe to assume that 0.9 to 1 liters an hour is a decent dosage for fluid replacement. Obviously, you don't want to consume this all in one gulp. I always like to recommend that you take sips or start drinking every 15 minutes. You maybe take a drink, sometimes even more, sometimes every couple minutes if it's really hot. Don't let yourself get thirsty. You don't have to take big gulps, just drink. Make sure you get it in. Don't put it in your mouth and spit it out either. Intake the fluid, drink the fluid, and be done with it. So Yes, there are certain supplements that people put in their pack. I put one supplement in my pack. Everybody uses different things. There are proper dosages for certain liters on the supplements that you use. A recommendation just in general would be to follow those guidelines that the companies use. Alright, so that's about it on hydration. If you have any other questions, feel free to hit me up. And if you're looking to make a nutrition plan or even hydration plan, sign up with me at Paddle Monster and I'll be happy to work with you. See ya.